This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, hello everybody. This is Robert, and welcome to the show today. And we're going to do things a little bit differently today. There'll be no worms, and there's going to be no germs. Instead, I'm going to focus on a very serious health issue that probably affects quite a few of you. And hopefully we can get something really good out of the show. And that's sleep apnea. Now, the number of people with obstructive sleep apnea has steadily increased over the past 2 decades. Now, the disorder, which causes a person to briefly stop breathing when asleep, affects more than 100 million people globally, and it's estimated to be undiagnosed 80 to 90% of the time. Obesity and advanced age, which have been reported as risk factors, are also on the rise. Now, sleep apnea can strike individuals of all ages, sexes, and body types. But people who are smokers, the obese, older people, males, and postmenopausal are most at risk. Often mistaken for snoring, sleep apnea patients choke and gasp during sleep when the airway involuntarily tightens. Low oxygen to the brain jolts the person awake in an attempt to normalize blood oxygen levels. The episodes can last from a few seconds to minutes, and they can happen more than 30 times per hour. The disorder is commonly treated with a CPAP machine, which pushes air into the airway so that it stays open throughout the night. Now, left untreated, sleep apnea can cause several problems associated with poor sleep quality. Patients with the disorder report daytime fatigue and morning headaches and memory or concentration issues. Emerging evidence also suggests untreated sleep apnea could be connected to more serious age-related diseases, such as non-alcoholic liver disease, metabolic syndrome, Alzheimer's and Parkinson disease, dementia, and type 2 diabetes.
Joining me today to talk about sleep apnea is Adam Amdur. Mr. Amdur is the Chief Patient Officer of the American Sleep Apnea Association. Mr. Amdur, welcome to the show, sir.
Thank you. Glad to be here. Hope everyone had a good night's sleep.
There you go. Good way to start. So let's start out with the basics. What is sleep apnea?
Sleep apnea is basically was termed and identified in 1972 by Dr. Christian Guilleminault and Dr. Bill Dement at the Stanford Sleep Center. Dr. Dement was renowned for discovering REM, rapid eye movement, in the late 50s, early 60s with his colleagues at the University of Chicago. And what they noticed is that when they were watching these patients' eyes moving really fast while their eyelids are closed, they noticed that some of these patients were holding their breath in their sleep for long periods of times. Technically, to hold an apnea, you have to hold your breath for 10 seconds to be scored an apnea event. There's also what's called hypopneas, which are partial obstructions, which are much more common before we ever get to so-called obstructive sleep apnea. But the way I would summarize it is sleep apnea should have been renamed sleep suffocation. It's basically someone putting a pillow over your mouth a certain amount of times an hour during the night without you ever knowing it, and then taking it off and then putting it back on.
Okay, well, that gives us a visual.
Not a pretty one.
Yeah, but like I said in the intro, sleep apnea affects about 10% of Americans. Pretty close to that. However, Adam, many of these go undiagnosed.
I would bet to say that the number's a lot higher than that, and it's not just sleep apnea, but sleep disorder breathing, which is a much bigger umbrella, and that's some of those hypopneas that I was talking about. We're seeing with much more in females and anyone that comes from a rice as a primary source of their nutrition. We're not developing the jaws like we used to a couple hundred years ago. We don't eat all the bones. With orthodontics, we've made our mouths narrower and smaller. So there's probably there's a third of the population has some sort of induced or not unconsciously induced sort of sleep deprivation component going on right now. So it's really a bigger pandemic problem than anyone realizes at this point. The problem is it's not a death disease. When you say cancer, you say stroke, you say heart attack, you say dementia, people get scared. When you say sleep apnea, the normal response is, oh, I'll just die in my sleep. It's very much a disease of denial.
So what are the symptoms of sleep apnea?
For adults, it's chronic fatigue, it's excessive daytime sleepiness, it's cognitive impairment. Some people might be battling diabetes issues and not realize there's a sleep component. Same with their cardiovascular issues, whether it's hypertension, AFib, or any other cardiovascular issues. Same can be said for mental health. If you're dealing with an anxiety, depression component of your life, whether you ever have factored in the sleep component. It's not that we think that everybody has sleep apnea. What we really want to learn is sort of to move towards the sleep health as the prevention, where everyone is making sleep the component, a part of the story. If you don't have the sleep component, you don't have the full story. That makes sense?
Yep, sure does. And there's certain things as far as you're sleeping too. I mean, there's symptoms while you're sleeping, like the stopping of breathing and that kind of stuff.
Yeah, it's the ones I really like to educate people on are really with children. There's every expecting mother in the world reads What to Expect When You're Expecting, and you'll find there's a lot of things in that book that's missing, and one of them is children sleeping in child's pose, which is a yoga position, and people think it's cute, but it's actually an early sign that the child's already protecting themselves. They're letting their tongue fall forward and pushing their rear end up in the air and pushing air into their diaphragm. So these are kind of things that we want to teach new mommies and grandmas about. These are things that we need to start being more aware of to ask our pediatricians about and let them know that we're seeing the children do this. We found my 2-year-old child at the time, she was wedged up against her bed every night because she was forcing air into her diaphragm. And at 2 years old, she had stopped breathing 27 times an hour. Now, anything for a child over 1 is abnormal. We believe with some of the research that we're doing and that we'll do in the future that really the only difference between SIDS, sudden infant death syndrome, and pediatric sleep apnea is that for most cases, not for all, but for most, remember I'm a layman, not a medical doctor, that a 1-year-old baby can roll over and catch its breath where a baby under 1 can't. And that's why a lot of babies unfortunately self-suffocate.
Now, there's several levels of severity with sleep apnea. And when I was diagnosed, they said I had moderate. I stopped breathing 23 times per hour. Can you discuss the different levels of severity?
Yeah, I can discuss it, and I'll discuss it more from a broader 30,000-foot view. It's really either you're pregnant or you're not. The mild, the moderate, severe is a scale that obviously the insurers and the medical community have set up, and it was set up a long time ago, and it was set up very arbitrarily, to be quite honest with you. We know that there's an entire population of what we call UARS, upper airways resistance syndrome, or people dealing with sleep disorder breathing that wouldn't even qualify on the mild part of the scale. So mild, moderate, severe is really in the middle of the thing. There's a whole nother part of that spectrum that's not even being accounted for.
Yeah.
If that makes sense.
Yeah. And there was another issue they pointed out to me was that my oxygen levels were going down to the 70s, 70%. range. So.
Yeah, so children won't desaturate as much, so because they'll have what more like microsleeps or partial obstructions. Where adults, because we've had this, it's an incremental behavior that we've learned over our years. So our sleep architecture changed. So you will start holding your breath from anywhere from 10 seconds to a minute and a half to 2. In my initial sleep study, my AHI was 76 within 20 minutes. Dr. Gimeno at Stanford said that if they would have let me go through a whole raw night, my AHI would have been about 150. But since I was so severe in a hospital setting, they had to treat me right away. Now, what's scary is that, and what was amazing is that I had an initial great first reaction when I had my split study titration. And so I woke up at 5:30 in the morning in a hospital setting. I ran home to my wife. I said, I know what all my problems were. But what's also very scary is that I then had to wait 2 weeks to get the treatment that I'd already been prescribed in the hospital because of the insurance issues.
Now, because of the issue that so many cases go undiagnosed, it's really important because sleep apnea carries with it some long and short-term health risk if it's left untreated. Can you elaborate on that?
Yeah, it's really, we can look at divorce rates. We can look at just, layman's explanations. We have a patient who's been on a machine who was at our FDA patient-focused medical product development meeting that we had this past June where we just reported on. His name was Rick Gordon, and he talked about his daughter said, Dad, we knew you started feeling better because when we came home, the house got quiet. You weren't yelling at us. You weren't irritable. You wanted to play with us. You didn't want us to stay out of your room or out of your office. So there's a lot of those factors that are going on. I mean, it affects your disposition at work. It affects if you're a kid, it affects your disposition. You want to get out of bed and actually go to school or interact in life. And it happens so incrementally that it just becomes your normal. You just think of that as your normal. I didn't know what a good night's sleep was until I had a split study titration, and I was forced to have therapy because I was so severe.
And then there's the health issues, which you kind of alluded to earlier in the interview, diabetes and coronary heart disease, and the list really goes on and on.
The list really goes on. The bottom line is everyone sleeps. So whether it's I'm someone who had a bilateral herniation in my neck, and I was taking statins as a prevention because I had a family history of heart disease. And this is all before I was diagnosed or treated, and I wound up almost in rhabdomyolysis because of an allergic reaction to statins. And you mentioned earlier your oxygen saturation went down. Well, that's one of my favorite advocacy points because anybody who has allergic reaction to a pharmaceutical, the first protocol should be, let's look at their oxygen levels. Unfortunately, that wasn't done for me, and I was sent on a wild goose chase and went to Parkinson's doctors and Lou Gehrig's doctors because my arms were in dystonia, and they couldn't figure out what was going on with me. Whereas if the doctors were up to speed, they would have known, oh, he had an allergic reaction? We need to look at the oxygen. These meds are designed for people getting full, rich oxygen, if that makes sense.
Yeah. Now, as far as diagnosis, I imagine the sleep study is the gold standard. Can you explain to the audience how this works?
According to the professional sleep doctors, it's the gold standard, but quite honestly, it's not. The best gold standard is the witnessed observation of an apnea event. The bed partner elbowing the mother or father watching the child hold its breath, a roommate, at 18 years old when a kid goes off to school, or a brother or sibling who won't sleep in the same room. That's more objective than anything. Mm-hmm. The testing confirms what else is going on and how severe or not severe the apnea might be, and if there are any other neurological or cardio or pulmonary issues. But there's been an industry based on testing. There's not been an industry based on treating this condition.
Right. So for somebody out there listening, if they want to know what the experience of the sleep study is, can you describe that? It's
the in-lab study is you come in and they try to mimic your home environment as best as possible, and you're connected with 27 leads, 27 different channels of data, and they're measuring everything from the most important thing that gets done in lab is your EEG, your brain waves, which is the only definitive way to tell what stage of sleep you're at. So a lot of people are walking around right now with Fitbits and all sorts of other wearables claiming that they know what stage of sleep they're getting. Those are highly inaccurate and highly misleading based on the data that we're seeing. So in lab, you have your EEG. It's measuring your respiration. It's measuring your oxygen. It's measuring your leg movements. It's measuring your CO2 levels at the facilities that are up to speed. That's always a good question to ask if they do measure your CO2, because it's just like you had. It's not as important how much oxygen you're desatting. It's how much CO2 you're holding on to in your lungs. That's doing more damage than anything.
Okay, well,
that's the poison.
Yeah. Well, let's go ahead and talk about treatment. Many people just watching TV have heard of the CPAP machine, the continuous positive airway pressure machine. How does this work?
CPAP machine is the gold standard, and it is the current go-to treatment option right now. And what it does is basically it stands for continuous positive airway pressure, or there's automatic positive airway pressures, or there's BiPAP, which is a pressure on the inspiration and a fixed pressure on the inspiration and a fixed pressure on the expiration. And what it does is basically it's like your garden hose. When your garden hose gets a kink in it when the water's on? That CPAP is stenting open your airway just with pressurized air. It's literally a vacuum blower with an algorithm. It's nothing more complicated than that, and it's nothing more non-invasive than that. It's more dangerous to take a sleeping pill, an Ambien, or a couple glasses of wine before you go to sleep than to use this therapy. Now, I will say, with that being said, the industry has no desire to look for a cure. This is a nice business model for them because it works and they know it works. So we are big proponents of using the therapy, but we very much want to look for prevention and early recognition and look for long-term cure solutions. Whether there's a so-called magic bullet or not is probably not most likely. But what we do know, there's multidisciplinary interventions, especially with children, where you can reverse 90% of all these issues that will manifest as a result of untreated sleep apnea.
Okay, and that kind of segues into my next question. What other sleep apnea treatments are available? I've heard there's surgery for certain types of conditions. What else do we have?
So right now, she's now 10 years old. Child is unfortunately the exception and not the rule. So at 2 years old, she stopped breathing 27 times. We took out her tonsils and adenoids, which used to be the norm a generation ago. Her AHI, her apnea-hypopnea index, went from 27 to 12. Remember, anything over 1 for a child is abnormal. Mm-hmm. So we increased her quality of sleep within 24 hours with a surgical intervention. The ENT thought that was all she would ever need at that point, but he was proven wrong because when we were walking out of surgery, he's like, wow, her mouth is really crowded. So we then worked with a pediodontist and our advisors at the Stanford Sleep Center, and I live in Florida, to find an orthodontist that would work with us to help expand my daughter's airway. So they use rapid palatal expanders. She then needed CPAP, so that's 3 different interventions. You then have to look at food intake and environmental allergies, because whether it's the air we breathe or the food we're eating, that causes internal inflammation, which can make it harder on your airway as well. The 4th intervention that she does, and it's hard to get a 10-year-old child to do at this point, is called myofunctional therapy, which is really a fancy way of saying tongue exercises. The orthodontist can expand the bones in their airways because their bones are still malleable, but you have to retrain the muscles how to breathe with your nose. Our nose is for breathing, and our mouth is for talking and eating.
Now, let me kind of go back a couple steps, back to the CPAP machine. From what I understand, and correct me if I'm wrong, you're essentially going to be on that for life unless you lose a lot of weight or something. Tell me.
Yeah, it's unfortunately, I like to tell people, people say, I'll never put that mask on, or I'd never wear that. I go, but you would put chemo or radiation into you before you would do this? Right. So, yes, it's something I'm going to have to use the rest of my life, and thank God I live in a time where there's electricity just was invented, because I could very much tell you I'm now 44 years old. Without this machine for the last 10 years, I'm a dead man. Mm-hmm. So it's both a curse, but it's changed my life. And it's changed my daughter's life, and that's why my wife and I got into the advocacy world, because once we put on our mask, theoretically, like they tell you on an airplane, we then started to help others around us.
Good. Any final thoughts? Any advice you have for listeners?
I would just say, we're in the month of Sleeptember. It's back to school time. It's back to work time. Everyone's coming out of summer vacation. And, I'd just like to say, make sleep a part of your life. Without it, we're all incomplete. Everyone sleeps. And if you haven't factored in the sleep component, you don't have the full story. So when you're talking to your specialty doctors, whether it's cardiologist, your endocrinologist, your allergist, whoever it may be, if they're not including the sleep component, so for example, children who present with ADHD, before they write a prescription for Ritalin or Adderall, they need to have a sleep workup to make sure that they rule out the most obvious thing in the room, which is probably pediatric sleep apnea at this point.
Okay. And for listeners that want to learn more, I'll put up the link to the American Sleep Apnea Association on the website, and you can check that out for yourself. And I want to thank you, Adam, for your time and your expertise, sir. I appreciate it.
Thank you so much. Have a good morning, and stay safe and dry in these upcoming storms, because I know a lot of our community is definitely concerned by that. So I want to make sure they take their machines with them if they have to get up and go.
There you go. Thanks, Adam.
Thank you.
Bye.
Great interview, and I want to thank Adam Amdur for his providing that expertise and that information on sleep apnea. Now, in 2013, that was the first time I saw research that linked sleep apnea to a biomarker for Alzheimer's disease in older adults. Now, a more recent long-term study of aging adults shows that those who report being very sleepy during the day were nearly 3 times more likely than those who didn't to have brain deposits of beta amyloid. This is a protein that's really the hallmark of Alzheimer's disease years later. Now, the research adds to a growing body of evidence that poor quality sleep could encourage this form of dementia to develop, suggesting that getting adequate nighttime sleep could be a way to prevent Alzheimer's disease. Now, factors like diet and exercise and cognitive activity have been widely recognized as important potential targets for Alzheimer's disease prevention. But sleep hasn't quite risen to that status, although that may well be changing. This is according to Dr. Adam Spira. He's an associate professor in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. He says, if disturbed sleep contributes to Alzheimer's disease, we may be able to treat the patients with sleep issues to avoid these negative outcomes. It's currently unclear why daytime sleepiness would be correlated with the deposition of beta amyloid protein, Spira says. One possibility is that daytime sleepiness itself might somehow cause this protein to form in the brain. Now, based on previous research, a more likely explanation is that disturbed sleep due to obstructive sleep apnea, for example, or inefficient sleep due to other factors, causes beta amyloid plaques to form through a currently unknown mechanism, and that these sleep disturbances also cause excessive daytime sleepiness. How about in the youngest of us all? Well, infants often aren't screened for sleep apnea, but a new study suggests the disorder may be tied to an increased risk of death in infants with congenital heart disease. And this comes from researchers at the University of Arizona College of Medicine in Tucson, where they have found that hospitalized infants with congenital heart disease and central sleep apnea are 4 times more likely to die during their stay in the hospital than infants with congenital heart disease alone. And if you want to learn more about the American Sleep Apnea Association, I'll go ahead and put the link on the website so you can check it out for yourself, see what they offer. And, well, getting close to a hard break. I want to encourage you to check out the website. It's outbreaknewstoday.com, outbreaknewstoday.com. And some of the headlines this week, the CDC is reporting more than 2,000 domestically acquired cyclospora cases since the spring. Big numbers there. Could be linked to better testing. Could be linked to just more of an issue. We see that plague is resurfacing in Madagascar after last year's massive outbreak that killed some 200 people. So you can check out that story on outbreaknewstoday.com. And after the break, we're going to go more into sleep apnea. Got some good guests, got some good topics. So hang in there and join us after the break.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. In our continuing coverage of sleep apnea today on the Outbreak News This Week radio show, I want to talk about a pretty interesting study that came out a few years ago. In 2015, it came out of Sweden. And it looked at a most interesting topic, and that's motor vehicle accidents risk and sleep apnea. Now, results show that patients with sleep apnea were nearly 2.5 times more likely to be the driver in a motor vehicle accident compared with a control group of other drivers in the general population. Further risk analysis found that severe, excessive daytime sleepiness, a short sleep duration of 5 or less hours, the use of sleeping pills were independent predictors of increased crash risk in patients with sleep apnea. Now, the study also found that the incidence of motor vehicle accidents was reduced by 70% among sleep apnea patients who use CPAP therapy for an average of about 4 hours per night. Now, this study provides very strong evidence that obstructive sleep apnea patients have an increased traffic accident risk, and that this risk can be modified if CPAP treatment is used adequately. This is according to principal investigator and senior author, Dr. Ludger Groth. He's an associate professor at the Center for Sleep and Vigilance Disorders at the University of Gothenburg in Sweden. He goes on to say, excessive daytime sleepiness is a common symptom of obstructive sleep apnea, which can cause you to awaken in the morning feeling tired, unrefreshed, despite a full night of sleep. Effective identification and treatment of sleep apnea is essential to reduce avoidable, life-threatening accidents caused by drowsy driving. Okay, next I want to go ahead and answer the question. How much sleep do you actually need? Well, I got this 2-minute audio clip that I want you to take a listen to, and it's probably a lot more hours than you imagined. So let's go ahead and take a listen to that.
Are you in debt? And no, I'm not talking about money. If you didn't get enough sleep last night, you are in a sleep debt and may owe your body rest. I'm Lauren Hale from the National Sleep Foundation. We know sleep is essential for survival and health, so don't shortchange yourself by not getting enough. How much is that? Well, it depends. After a comprehensive review of its world-famous recommendations, the National Sleep Foundation released its latest set of expert guidelines in early 2015 with input from many leading medical organizations. These are grouped into recommended sleep ranges specific to every age group. I'll walk you through them. But keep in mind that you are unique and how much sleep you need is really up to your own body. So, how much sleep do we recommend? For newborns, 14 to 17 hours of sleep is recommended. It's recommended infants get between 12 and 15 hours of sleep. For toddlers, we recommend between 11 and 14 hours. Note that newborns, infants, and toddlers get the sleep they need over a 24-hour period, including naps. Preschoolers need a little less. We recommend 10 to 13 hours. It's recommended that school-age kids between 6 and 13 years of age get anywhere from 9 to 11 hours of sleep. Teenagers between 14 and 17 years of age need more sleep than they may think, from 8 to 10 hours per night. Our recommendation for young adults up to age 25 is 7 to 9 hours. Same goes for adults. We recommend 7 to 9 hours a night. Finally, for seniors over 65, the recommendation is between 7 and 8 hours a night. Remember, there is no substitute for good restorative sleep. Most people will fall within the National Sleep Foundation's recommended ranges, but sleep needs are individual.
All right. So I imagine you didn't think you required that much sleep. But you can check out that information. I'll put the link to that on the website. Well, let's talk about the most common type of treatment, the CPAP, or continuous positive airway pressure. With obstructive sleep apnea syndrome, physical blockages or obstructions in the airway occur during sleep, usually because the back of the tongue collapses against the soft palate and the soft palate collapses against the back of the throat. Now, obstructions that cause breathing to stop completely for at least 10 seconds are termed apneas. When breathing is substantially reduced for at least 10 seconds, it's a hypopnea. Hope I said that right. Frequent apneas and hypopneas lead to numerous brief awakenings during sleep, arousals that are usually not remembered, and to sleepiness during waking hours. Preventing apneas and hypopneas prevent sleep fragmentation, so treatment reduces the daytime sleepiness. The precise cause of obstruction is usually difficult to find, and many people have obstructions in more than one place. Now, the CPAP is the most effective and most widely used method for treating obstructive sleep apnea, particularly in its severe form, 25 or more apneas or hypopneas per hour. The CPAP machine works by gently blowing pressurized room air through the airway at a pressure high enough to keep the throat open. This pressurized air acts as a sort of a splint. The pressure is set according to the patient's needs, high enough to ensure that the airway is fully open when the sleeper inhales, but not so high that the sleeper is disturbed by the sensation. Now, the obstructions of the airway occur during sleep, but not during the waking hours, partly because all muscles, including the muscles of the throat, relax during sleep.
Now, up to 90% of individuals with sleep apnea are undiagnosed, and a large number of them are African Americans. Now, a new study by investigators at Brigham and Women's Hospital looked at the prevalence of sleep apnea among African American men and women living in Jackson, Mississippi, and participating in the Jackson Heart Sleep Study. Now, the study was published in the journal Sleep, and I'll put a link to that on the website. Now, joining me today is the lead author of the study, Dayna Johnson, Ph.D. Dr. Johnson is an associate epidemiologist in the Division of Sleep and Circadium Disorders at Brigham and Women's Hospital. Dr. Johnson, welcome to the show, ma'am.
Hi, thank you for having me.
You bet. Well, let's go ahead and start out with just a summary on sleep apnea and why it's an important health issue.
Sure. So sleep apnea, as you mentioned, is a very common condition. And so sleep apnea is defined as frequent periods when breathing stops throughout the night, and it's extremely prevalent. So meaning many individuals have sleep apnea, particularly African American. And one of the reasons why it's so important is it often goes underdiagnosed and therefore undertreated. So again, this is several periods throughout the night where people stop breathing and they're not being treated for this. And so the other reason why sleep apnea is so important is because it affects quality of life. So again, since you have these periods throughout the night where you're not breathing, it leads to sleepiness. So it disturbs your sleep. So you tend to be tired throughout the day, which we know is associated with accidents. So that's both drowsy driving as well as occupational accidents. And then also, as you mentioned, sleep apnea is associated with several adverse health outcomes. And so we know it's associated with uncontrolled hypertension, stroke, heart failure, as well as other conditions. And so again, in these conditions tend to be more common among African Americans.
So let's go ahead and take a look at your study. Essentially, what was the objective of the study?
Sure. So the goal of our study was truly to define how many people have sleep apnea, how many African Americans that are part of the Jackson Heart study are affected by this condition. And then also, we wanted to know how many of those people were undiagnosed. And then the last part was to look at some of the factors that are related to sleep apnea. So there's a number of risk factors that are known. And so we were interested in seeing if African Americans had the same risk factors, was the severity any different, and be able to compare that to other studies.
And how did you perform the study, and what were your findings?
Sure. So this is a paper that comes from a larger study, the Jackson Heart Sleep Study. And so as part of this study, we brought in African Americans from Jackson, Mississippi, and we did a clinic visit. And then we also performed a sleep apnea test within the homes. And so the participants wore a sleep monitor every night. And from there, we were able to define these periods when their breathing stopped. And so for there, we defined sleep apnea. And so taking the information from the home test as well as from the clinic visit, we performed an analysis where we looked at the prevalence of those with sleep apnea, and then again looking at some of the factors that we collected in the study to see how well they related to sleep apnea. And so what we found was a high prevalence of sleep apnea. So in terms of moderate or severe sleep apnea, we found that about 37% of the population were affected. And then if we just look at any type of apnea, so having mild up to severe sleep apnea, we saw that over 75% of the population were affected. We also found that there was a high prevalence of undiagnosed sleep apnea. So only about 5% of our participants knew that they had sleep apnea, so meaning that they were diagnosed by a physician as having sleep apnea. A very small percent, again, meaning 95% were undiagnosed, which is large and a higher percentage than we see from other studies. And then when we looked at some of the factors that relate to sleep apnea, we did confirm what other studies have found. So things like body mass index, which is a measure of obesity. We found that that was highly related to sleep apnea, and also snoring, which is one of the risk factors. So loud snoring or snorting sounds, that's one of the risk factors of sleep apnea, or one of the ways that you may define or get screened for sleep apnea if you have that. And then also males. So males had a higher prevalence compared to females. And so that was in general what we found as part of the study. But again, the most important part being that we found that so many people were undiagnosed with sleep apnea.
Right. And getting sleep apnea diagnosed in the general public is a health challenge. And based on your findings, African Americans are severely affected. Dr. Johnson, what can be done to reverse this trend?
Great question. Great question. I think one of the most important things that we can do, which you're doing as part of your show, is raising awareness about sleep apnea. So again, as for many of the reasons I mentioned earlier, sleep apnea is an important condition which has severe consequences. So it's important for people to understand what are some of the warning signs. So as I mentioned, habitual snoring or loud snorting. So being able to identify these, and also getting screened. So if you have any other risk factors, be sure to share that with your primary care doctor so you can be referred for a sleep study. So this is a condition that can be treated. And so the more that people know about the condition, able to define what are some of the symptoms of the condition, and then getting diagnosed so they can be treated. So I would say those are some of the most important things we can do in order to affect and hopefully prevent this high trend or this high prevalence among all populations, but particularly African Americans who are most affected.
Very good. So what's next? Are you planning some follow-up research to this study?
Yes, we are. So I mentioned earlier some of the consequences of sleep apnea, so the conditions that it tends to lead to. So again, this is information that we've gathered from mainly non-Hispanic white populations. And so our study, the Jackson Heart Sleep Study, again, is of all African Americans. So we're able to use some of the data that we've collected as part of this study to understand what are the consequences specifically in this population. So right now we're working on a paper that's looking at the contribution of sleep apnea to uncontrolled blood pressure. So this is, again, a highly prevalent condition among African Americans, uncontrolled blood pressure. But the reasons for why African Americans have such a high prevalence are unknown. And so from our study, we're looking at sleep apnea as a potential contributor. And again, most of the studies that have looked at uncontrolled blood pressure have looked at some of the traditional risk factors or medications, diet, physical activity, and have not explored sleep apnea. And so we're currently working on that, and we hope to have those results disseminated in the next few months. And so, and then we have a few other studies that will also look at other cardiovascular consequences of sleep apnea, as well as look at some of the predictors of sleep apnea among African Americans. So really expanding. And then going back to your earlier question about what can be done. So along that same vein, we're developing a model to be able to identify sleep apnea. So some of these studies to diagnose sleep apnea tend to be pretty expensive. Right. And so we're doing some statistical modeling to be able to gather different information. So some of which we reported in the current study, such as neck circumference and snoring, as well as other sleep symptoms, and being able to combine those in order to identify a person's risk for sleep apnea.
Well, very good. Some very interesting and important work that you're doing. And I want to thank you, Dr. Dayna Johnson, for your time and your expertise, ma'am. I appreciate it.
Sure, you're welcome. Thank you for having me.
Yeah, and I want to thank Dr. Dayna Johnson for spending the time to go over her research and a very interesting topic of sleep apnea in African Americans. And I'll put a link to her study on the website. Well, how about diagnostics? Well, a sleep study in a hospital or similar facility is one way. Now, last year, the American Academy of Sleep Medicine released a new position statement which describes the appropriate clinical use of a home sleep apnea test, or the HSAT. A home sleep apnea test provides valuable information for the diagnostic assessment of certain patients with suspected obstructive sleep apnea. This is according to AASM President Dr. Eileen Rosen. She goes on to say, however, the test is only one component of a comprehensive sleep evaluation, and it's important for a board-certified sleep medicine physician to be involved in reviewing and interpreting the raw data from the device. Now, the statement, which was published last October in the Journal of Clinical Sleep Medicine, comprises of the following positions. Only a physician can diagnose medical conditions such as obstructive sleep apnea and primary snoring. The need for and the appropriateness of the HSAT must be based on the patient's medical history and a face-to-face examination by a physician, either in person or via telemedicine. An HSAT is a medical assessment that must be ordered by a physician to diagnose obstructive sleep apnea or evaluate treatment efficacy. An HSAT should not be used for general screening of asymptomatic populations. It continues that diagnosis, assessment of treatment efficacy, and treatment decisions must not be based solely on automatically scored HSAT data, which could lead to suboptimal care that jeopardizes patient health and safety. And lastly, the raw data from the HSAT device must be reviewed and interpreted by a physician who is either board certified in sleep medicine or overseen by a board-certified sleep medicine physician. Now, a study published last year in the journal Menopause, researchers found that hot flashes and night sweats faced by upward of 80% of middle-aged women may be linked to an increased risk of obstructive sleep apnea. Obstructive sleep apnea, the most common form, is characterized by repeated sleeping and stopping, the researchers say. Besides affecting the quality of sleep, OSA can also lead to serious health concerns in women, including increased risk of coronary heart disease, high blood pressure, and stroke. So what the researchers did is to track this occurrence in middle-aged women, they used a data registry on experience of aging, menopause, and sexuality, which contains health information on women seen in the Women's Health Clinic at the Mayo Clinic. The team found that of the women seen between May 2015 and December 2016, self-reported severe hot flashes and night sweats were linked to an intermediate to high risk of obstructive sleep apnea, while those who had high blood pressure and were obese were at a really especially high risk. The risk was also seen in women with a healthy body mass index. Now, one of the researchers, Dr. Stephanie Fabian, said, obstructive sleep apnea is often thought of as a man's disease, and men's symptoms are more outwardly noticeable, in a large part because of snoring. However, the risk for obstructive sleep apnea in women goes up in their menopausal years. The symptoms they face, headache and insomnia, and anxiety and depression, in addition to the more common symptoms of snoring and fatigue, may not be as audible or visible to others, but they pose just as much risk to overall health. Now, 2 years after clinical consultation, when women self-reported their hot flashes and night sweats, 65% of the group that demonstrated intermediate or high risk of obstructive sleep apnea still was not diagnosed with the condition. Hot flashes and night sweats may be overlooked as a risk of something more serious, said Dr. Fabian. The implementation of screening tools during evaluation can help determine what symptoms women are facing and put us on track to detect and intervene with serious health issues, such as obstructive sleep apnea, sooner. Then there's this other study that came out last week, 2 weeks ago, that says that treating sleep apnea greatly improves stroke patients' neurological and functional recovery. And the large study has found that commencing treatment for sleep apnea as soon as possible after a stroke or a mini stroke significantly improves speech impairment and other neurological symptoms, as well as walking and other physical functioning. Now, we have shown for the first time in a randomized controlled study that for individuals who have had a stroke or a TIA, a transient ischemic attack, also known as a mini stroke, the diagnosis and the treatment of sleep apnea with a CPAP machine provides significant benefits, even greater than the benefits of tissue plasminogen activator, the FDA-approved drug treatment for stroke. This is according to Dawn Bravada, MD, who led the study. That's a substantial clinical effect. The added good news for stroke patients is that the CPAP has been used as a sleep apnea therapy for many years, and it has an excellent safety record, she said. Now, stroke is the 5th leading cause of death in the U.S., and according to the National Institute of Neurological Disorders and Stroke, more than 780,000 strokes occur every year in the U.S. Now, the TIAs produce symptoms similar to those of a stroke, but typically last only a few minutes and usually cause no permanent damage. An estimated 1/4 of individuals who experience a TIA will eventually have a stroke, and about half of these strokes occurring within 12 months after the mini stroke. Now, sleep apnea is common among patients with stroke or TIA. Although few stroke patients are currently diagnosed and treated, approximately 2 out of every 3 are thought to have sleep apnea, a disorder which breathing during the sleep is irregular. Sleep apnea can cause low oxygen levels, high blood pressure, and heart rhythm issues. CPAP for sleep apnea can be used safely in addition to other stroke therapies, most of which have known adverse effects. For example, the TPA, a clot buster, can induce non-trivial bleeding. Anyway, so that's a very interesting study from the Rodebush VA Medical Center in Indiana. Anyway, we're running out of time, and let me go ahead and close the show. And I will see you next week on Outbreak News This Week. Good night, and God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.